starting. This is our photographer, filmer, the corner. Okay.
Hi, I'm Danielle Flynn. I'm a student nurse at the University of Detroit Mercy. I'm here to do your assessment today. It should take about 15 minutes. How are you feeling today?
Good.
What kind of mood are you in?
Happy.
Okay, I'm just going to wash my hands. From the chart, patient states or appears to stated age. There's no signs of deformities or illness. Patient states her mood is happy, and her affect appears to be appropriate with the mood. Okay. Do you have any allergies?
No.
Are you in any pain?
No.
Okay, if she was in any pain, I would assess the PQRSTU. Okay. And can you state, or a patient is also well groomed and appropriate for the weather. Can you state your name?
Madison Forsyth,
Okay. And your birthday?
2/26/91,
And do you know what today's date is?
June 8th.
Okay. Patient is alert and oriented ×3. Congruent speech. Okay. And I'm gonna first start with your hair. Okay. I'm checking for parasites and lesions, which there do not appear to be any of those. Hair is symmetric across the whole entire head. Okay, I'm gonna go down to your face. No diaphoresis. Skin is warm to the touch. Okay. Now I'm gonna go to your eyes. Okay, can you look at me? Okay. I'm going to shine the. You're gonna look forward. I'm gonna shine the light into your eyes. Okay, pupils constrict, and they are consensual. Pupils are equal, symmetric, round, react to light. I'm going to check your conjunctiva, which is pink. Okay, and now I'm going to check your mouth if you can open your mouth up. Okay, uvula is midline, tongue is midline. There's no signs of lesions. Teeth are white, gums are pink, mouth is pink, oral mucosa is pink. Tonsils are +1, they're present. Okay, and now I'm going to test your cranial nerve 5. If you could close your eyes for me. And whenever I touch your face, just say now.
Now. No. 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 No.
Okay, and I'm going to test your cranial nerve 7. Can you raise your eyebrows? Smile. And can you puff out your cheeks? Okay. Next, I'm going to check your carotid. Skin is still warm, no diaphoresis. Carotid pulse is 2+. 2+ bilateral. Now I'm going to listen. Whenever I tell you, can you breathe in, then breathe out, and then just hold it? Okay, breathe in and out, and just hold it. Okay, there's no signs of breathe on that side. And just do the same thing over here. Breathe in and out, and then hold it. And there's no signs of breathe on that side as well. Okay, I'm going to check your skin turgor. Goes back to its original shape. No signs of dehydration. Now I'm just going to feel your arms. No signs of lesions. Skin is warm. No diaphoresis. Okay, I'm going to check your brachial pulses. 2+ bilaterally. Now I'm checking your radial. 2+ bilateral. Okay, take your hands. Can you go like this for me? Fingernails are there's no signs of clubbing. Fingernails are concave. Capillary refill is less than 3 seconds, so that's well. Okay, and then can you grab my fingers? And strength is strong. Strong strength. Okay. Now I'm gonna check your heart. Okay. Okay. First I'm gonna check the aortic, which is in the right intercostal space, or the second intercostal space. Okay, and then I'm gonna move over to the pulmonic, which is in the right, or the left second intercostal space. Down to Erbs, which is in the third. Okay, and then can you just switch? This is the tricuspid in the fourth intercostal space on the left. And then can you push up? And now I'm listening to the mitral, which is the fifth intercostal space. And I would listen for 60 seconds to listen to apical heart rate. And then I would go back up with the bell. S1 is heard loudest at the apex, and S2 is heard loudest at the base. There were no murmurs present, and there was no murmurs present at S3 or S4. Okay, now I'm going to listen for your breath sounds. Every time I touch, just take a deep breath in and a deep breath out. And I'm going to listen to the lateral. Okay, there was no wheezing or crackling, no adventitious sounds. Okay, I'm going to go to listen to your arm back. AP diameter is 2 to 1. You can bend forward for me. No scoliosis. And I'm going to check your CVA tenderness. Any pain? Okay. Any pain? Okay, there's no signs of kidney inflammation. And now I'm going to listen for your lung sounds in the back. With the same as the front, every time I touch the stethoscope to your skin, just take a deep breath in and out. And there was no adventitious sounds or wheezing or crackling there either. And I'm just going to, do you have to go to the bathroom at all?
Yeah.
Okay, I'm just going to have you lay back and check your abdomen, which I'll be on the right side. Excuse me. Okay. First I'm going to check. Flat. No signs of nevi or anything. But if there ever is, just remember to do your ABCDs. A's symmetry. Just check if it changes at all. Border, if it's defined and everything, if that ever changes also, just check. If the color ever changes. The diameter, if it ever becomes more than 6 centimeters, and if it ever becomes elevated, just go get it checked out. There is a scar above the umbilicus, which previously she said was from a previous umbilicus ring. Umbilicus is inverted. No other scarring. I'm going to listen to your bowel sounds now. Okay. Start with the right lower quadrant. vowel sounds are present in all 4 quadrants. Then I'm going to percuss. Okay, you can hear Tiffany in all 4 quadrants. Now I'm going to palpate using 3 fingers, 1 centimeter light palpation. In the right lower quadrant, you will find the appendix, the right ovary and tube. And then in the left lower quadrant, you'll find the descending colon and the sigmoid colon, along with the left ovary and tube. And then up in the left upper quadrant, you will find the spleen, the stomach, and the body of the pancreas. And then over in the right upper quadrant, you will find the liver, the gallbladder, and the head of pancreas. Is there any pain? No? And there's no masses found, so that's a good thing. Okay, now I'm going to go down. You can lower your shirt now. Okay, and I'm going to just, if I would check the femoral pulse for this case, I'm going to check. Temperature is still warm. There's no scarring or any lesions. Okay, I'm going to check the popliteal pulse. It is 2+ bilateral. Then I will check the posterior tibial. 2+ bilateral. And there are no signs of edema. Okay, and then I'm going to check the dorsalis pedis pulse, which is 2+ bilateral. And then I'm going to check for capillary refill, which is less than 3 seconds. Okay, now I'm going to help you up. Okay, and if you can stand for me, in case you can get up well. Okay, and I'm just going to have you walk with heel to toe. Okay, and turn around. Okay, and there's a steady gait. Now, if you can just close your eyes and stand. I would do this for 20 seconds. And then since there's no swaying, it is a negative Romberg test, but if there's swaying, show a positive Romberg test. And I'm going to go back. If you can sit down, I forgot one thing. I'm going to do the Bendinski reflex. Just have it. Okay. Negative Bendinski. And negative on this side too. If there was a positive, the toes would fan out. And that is all.